cool.
After checking patient's progress note and pathology request, I found that patient has a Jackson Plot drainage system at her left side. Therefore, I will be demonstrating how I can assess her drain side, and as well as how to care of drain using aseptic technique and send the swab to culture sensitivity. Firstly, I need to perform hand hygiene before touching the patient. Good afternoon, Ms. Belovich. My name is Namukin. I'm a nursing student. I'm just going to check your drain site area and take a sample for examinations and apply a new dressing to it. Is that okay? Good. Before I start, do you have any questions or problems about your drain that you would like to discuss with me, such as pain, for example? Then I remove the older dressing and examine the dressing for any drainage. If there is drainage, then I will examine the color, the amount, and any odor.
During the inspection of drain site, nurses should check for signs of infection around the drain site, such as any redness, swelling, and pain. Also, if there is any drainage, observe the color and odor, for example if it is foul-smelling. Fever can also be a sign of infection, so therefore it is important to check her vital signs. If there is large amounts of drainage, or if the drain is not secured or in the correct position, the drainage may leak around the drain site, causing the dressing to be soaked. If this happens, ensure that after the culture is taken, the area is cleaned properly, and if there are any drain malfunctions, tell the medical officer. We should also ensure by observing that drain site and all along the actual drain that no clot has formed, as this could prevent the drainage from flowing through the tube and cause a buildup of drainage.
Now I'm going to show how to care of drain
and drain site. Firstly, we must set up a sterile field, which includes cleaning the trolley for top to bottom and from inside to outside.
Ensure hands are washed before opening dressing pack, and also check the expiry date of the dressing pack.
Now I'm opening the dressing pack.
It is important when opening the dressing pack that we should not touch the inside of the pack.
Now I'm putting the large combined dressing. The expired date is 2000 to 2013. And split drainage dressing, expired date is 2009. Alright.
When you prepare the sterile gloves to be put on, you should not touch the outside of gloves. We use our dominant hand first.
I can touch now.
Once we have the sterile gloves on, we then move back to the sterile field where the dressing equipment is placed.
I want to obtain a drain culture to send for examinations. It's an aseptic procedure, so I need to ensure I undertake hand hygiene and wear an apron and sterile gloves. Put in here. Yep. Firstly, I remove the cap of the top of the swab container while ensuring I don't touch the top of the swab. Then carefully take a swab of the drain side. Just gently rotating and put in the container. Yep.
After the specimen is collected, the container itself, which excludes the lid, must also be labeled with the client's name, identification number, specimen source, collection date and time, series number if more than one specimen, and anatomical site if appropriate. The collected specimen should be enclosed in a biohazard plastic bag for transport. Specimens need to be delivered promptly to the laboratory because when some specimens are left at room temperature, false abnormal findings may result. You are responsible for knowing normal lab results and when to notify the physician of abnormal results.
And send the sub for the test. Forceps. The other pair of forceps, which is dirty pair, and to clean the wound. I clean the drain site from least contamination. And dry one. Now that the drain site is clean, I will place the split dressing here. Place the split dressing here in positions followed by a secure with micropo tape. Followed by a secondary dressing on top in case of excess drainage.